What is pediatric vulvovaginitis? Vulvovaginitis is a condition that causes irritation, such as itching or redness and/or discharge in the area of the vulva and/or the vagina. What causes pediatric vulvovaginitis? There can be many causes of pediatric vulvovaginitis. Girls are more susceptible to skin irritation because their hormone levels are much lower than adults. This means the vulvar and vaginal skin is very thin and sensitive. Common causes of pediatric vulvovaginitis are allergic reaction, contact dermatitis, and certain types of bacteria. There are also other causes and sometimes several different causes at once. Who gets pediatric vulvovaginitis? Pediatric vulvovaginitis can occur in females of any age, including newborns, toddlers, and children. It's a condition that occurs in girls who are premenarchal, which means they have not yet had a menstrual period. What are the symptoms of pediatric vulvovaginitis? Itching, burning, and pain in the vulva and/or vaginal areas. Vaginal discharge that is yellow or brown. Vaginal bleeding. How is pediatric vulvovaginitis diagnosed? Vulvovaginitis is evaluated first by talking with a doctor about your child-teen's health history and symptoms. After carefully reviewing the history and symptoms, the doctor will perform a physical exam, which includes looking at the external vulva and rectal area. This examination is not painful and does not include an internal pelvic exam. There is no specific test that is done to evaluate this condition. In certain circumstances, a vaginal culture may be done, but it is usually not needed. How is pediatric vulvovaginitis treated? The good news is that most girls will get better after making the following changes. Wear only plain white cotton underpants. Wash them with a tiny amount of unscented detergent and rinse twice to remove any remaining irritants from the detergent. Avoid fabric softeners or any extra cleaning or freshening products on underwear and swimsuits. Wear a nightgown for sleeping. It's okay to sleep without undies. Avoid one-piece sleeper pajamas. Very loose, soft PJ pants or loose boxer shorts are another option. Avoid tights, one-piece leotards, tight jeans, or leggings. Choose skirts and looser-fitting pants. Find clothes that are comfy, allow air to circulate, and don't cause extra rubbing or pressure. Take a bath every day. We may recommend this more than once a day until your child is feeling better. Make sure that the bathtub is rinsed free of bleach, cleaning products, or any leftover soap or bubble bath. Soak in clean, warm water. No soap, vinegar, or baking soda is needed. Plain warm water is best to avoid irritation. Don't scrub the vulva with a washcloth. Just allow the water to gently wash over and soak the area. Only use a mild soap like Dove when and where it is really needed, like on skin with visible dirt. Use soap at the end of a bath and then wash it completely off. Soap is usually not needed in the genital area. Gently pat dry the genital area. Don't use bubble bath or perfumed soap. When your daughter is the right age, tell her not to use feminine sprays, douches, powders, or other scented feminine products. If the vulvar area is swollen, tender, or itchy, use a cool compress for a few minutes. Vaseline or A&D diaper ointment can also be used to help protect the skin. Talk about and remind your child how to wipe after a bowel movement. Wiping from the front to the back is important to keep the bacteria away from the vulva. After swimming, change into dry clothes right away. When can we expect things to get better? Using the self-care tips above, symptoms usually get better in 1 to 2 weeks. What if things are not getting better? If your child-teen's condition does not improve, or if you have new symptoms to report, please call your doctor. How can I prevent my child from developing vulvovaginitis? Hygiene. Simple skincare can help to prevent your child from developing vulvovaginitis. Treat the skin of the vulval area very gently. Do not overwash the area. Encourage your child to wipe from front to back. To stop the skin from becoming irritated, avoid the following things: bubble baths, scented soaps or creams, colored, printer or scented toilet paper, nappy wipes, talcum powder, clothing and laundry. Some washing products and tight clothing can irritate the vulva. Things that can help prevent vulvovaginitis include cotton underwear. Avoid wearing tights and leggings. Avoid laundry, rinse aids in the washing machine. Ensure laundry detergent is rinsed well from your child's underwear. Physical activity. If your child has played sports or been active, change them out of their sports clothes as soon as possible after exercise. Remove swimming costumes soon after swimming. Where possible, avoid lengthy activities that put direct pressure on the vulva, such as bike and horse riding.